Bleeding during pregnancy is common, especially during the first trimester, and usually it's no cause for alarm. But because bleeding can sometimes be a sign of something serious, it's important to know the possible causes and get checked out by your doctor to make sure you and your baby are healthy. What's the difference between bleeding and spotting? Bleeding or spotting can happen anytime, from the time you get pregnant to right before you give birth. Spotting is light bleeding. It happens when you have a few drops of blood on your underwear. Spotting is so light that the blood wouldn't cover a panty liner. Bleeding is when the blood flow is heavier, enough that you need a panty liner or pad to keep the blood from soaking your underwear and clothes. Call your healthcare provider if you experience spotting or bleeding. They may want to examine you or perform an ultrasound to determine the cause. It's better to be overly cautious to ensure you and the fetus are healthy. Bleeding in the first trimester. About 20% of women have some bleeding during the first 12 weeks of pregnancy. Possible causes of first trimester bleeding include 1. Implantation bleeding. You may experience some normal spotting within the first 6 to 12 days after you conceive, as the fertilized egg implants itself in the lining of the uterus. Some women don't realize they are pregnant because they mistake this bleeding for a light period. Usually the bleeding is very light and lasts from a few hours to a few days. 2. Miscarriage. Because miscarriage is most common during the first 12 weeks of pregnancy, it tends to be one of the biggest concerns with first trimester bleeding. However, first trimester bleeding does not necessarily mean that you've miscarried or will miscarry. In fact, if a heartbeat is seen on ultrasound, over 90% of women who experience first trimester vaginal bleeding will not miscarry. Other symptoms of miscarriage are strong cramps in the lower abdomen and tissue passing through the vagina. 3. Ectopic pregnancy. In an ectopic pregnancy, the fertilized embryo implants outside of the uterus, usually in the fallopian tube. If the embryo keeps growing, it can cause the fallopian tube to burst, which can be life-threatening to the mother. Although ectopic pregnancy is potentially dangerous, it only occurs in about 2% of pregnancies. Other symptoms of ectopic pregnancy are strong cramps or pain in the lower abdomen and lightheadedness. 4. Molar pregnancy. This is a very rare condition in which abnormal tissue grows inside the uterus instead of a baby. In rare cases, the tissue is cancerous and can spread to other parts of the body. Other symptoms of molar pregnancy are severe nausea and vomiting, and rapid enlargement of the uterus. 5. Cervical changes. During pregnancy, extra blood flows to the cervix. Intercourse or a pap test, which causes contact with the cervix, can trigger bleeding. This type of bleeding isn't cause for concern. 6. Infection. Any infection of the cervix, vagina, or a sexually transmitted infection, such as chlamydia, gonorrhea, or herpes, can cause bleeding in the first trimester. These infections will need to be treated by your healthcare provider. Bleeding in the second and third trimesters. Abnormal bleeding in late pregnancy may be more serious because it can signal a problem with the mother or baby. Call your doctor as soon as possible if you experience any bleeding in your second or third trimester. Possible causes of bleeding in late pregnancy include 1. Placenta previa. This condition occurs when the placenta sits low in the uterus and partially or completely covers the opening of the birth canal. Placenta previa is very rare in the late third trimester, occurring in only 1 in 200 pregnancies. A bleeding placenta previa, which can be painless, is an emergency requiring immediate medical attention. 2. Placental abruption. In about 1% of pregnancies, the placenta detaches from the wall of the uterus before or during labor, and blood pools between the placenta and uterus. Placental abruption can be very dangerous to both the mother and baby. Other signs and symptoms of placental abruption are abdominal pain, clots from the vagina, tender uterus, and back pain. 3. Uterine rupture. In rare cases, a scar from a previous C-section can tear open during pregnancy. Uterine rupture can be life-threatening and requires an emergency C-section. Other symptoms of uterine rupture are pain and tenderness in the abdomen. 4. Vasa previa. In this very rare condition, the developing baby's blood vessels in the umbilical cord or placenta cross the opening to the birth canal. Vasa previa can be very dangerous to the baby because the blood vessels can tear open, causing the baby to bleed severely and lose oxygen. Other signs of vasa previa include abnormal fetal heart rate and excessive bleeding. 5. Premature labor. Vaginal bleeding. Late in pregnancy may just be a sign that your body is getting ready to deliver. A few days or weeks before labor begins, the mucus plug that covers the opening of the uterus will pass out of the vagina, and it will usually have small amounts of blood in it. This is known as bloody show. If bleeding and symptoms of labor begin before the 37th week of pregnancy, contact your doctor right away because you might be in preterm labor. Other symptoms of preterm labor include contractions, vaginal discharge, abdominal pressure, and ache in the lower back. What to do if you have abnormal bleeding during pregnancy? Because vaginal bleeding in any trimester can be a sign of a problem, call your doctor. Wear a pad so that you can keep track of how much you're bleeding and record the type of blood, for example, pink, brown, or red, smooth, or full of clots. Bring any tissue that passes through the vagina to your doctor for testing. Don't use a tampon or have sex while you are still bleeding. Your doctor might recommend that you rest as much as you can and avoid exercise and travel. You should expect to receive an ultrasound to identify what the underlying cause of your bleeding may be. Vaginal and abdominal ultrasounds are often performed together as part of a full evaluation. Go to the emergency room or call 911 right away if you have any of the following symptoms, which could be signs of a miscarriage or other serious problem. Severe pain or intense cramps low in the abdomen. Severe bleeding, with or without pain. Discharge from the vagina that contains tissue. Dizziness or fainting. A fever of more than 100.4 or more degrees Fahrenheit and or chills. Does bleeding mean I am having a miscarriage or might lose my baby? Bleeding in early pregnancy is very common and does not necessarily mean you are having a miscarriage. Many women who experience bleeding in early pregnancy go on to have healthy babies. In some cases, bleeding can be the first sign of a miscarriage. If you are experiencing bleeding in early pregnancy, contact your doctor or midwife for advice. Bleeding at any point in pregnancy can be scary. Sometimes bleeding during pregnancy is serious, but other times it isn't. It's important to contact your healthcare provider to discuss any vaginal bleeding you experience while pregnant. They'll want to rule out any complications, find the cause of your bleeding, and make sure you and your fetus are healthy. So that was all for today's video. We hope you liked the video, and our tips will help you in your parenting. For more videos like this, do subscribe to our channel, and please leave a like to show us that our tips help you. See you next time.